Good evening, everyone, and welcome to our training tonight. Medical contouring, when makeup inspires medical aesthetics in treatment of younger patients. And please welcome our expert for tonight, Dr. Frédéric Braccini, facial plastic surgeon in France. Hello, Frédéric.
Hello, Raphaël.
Dr. Braccini is among us this evening to share with you his various techniques. If you have any questions, please feel free to ask them on our live chat. I wish you a great evening and an excellent training. And to you, doctor, have a great live.
Thank you, Raphaël. My dear friend, I'm very pleased to take place here in Paris, I think for the third time for SIP Channel. And tonight we'll share together for a webinar with live demonstration during 1 hour this new technology, new technique in injection of the face. The name is maybe not the best one, because the contouring technique is not exactly the right name that we will show tonight, but the right name is the highlighting procedure. And we will, I will show you, of course, the analysis of the patient, the philosophy and the technique, and why these new techniques are on the market. The highlighting procedure are growing in the indication, and why we have to manage younger and younger patients in order to preserve the natural. So to find where are the right points on the face to obtain the best result. These techniques of injection with HA on the face are coming from the makeup techniques, from the contouring. And you know that the contouring is a technique, a makeup technique, when you, with the brush, you can make dark region of the face, and you will increase the natural region of the face. But in opposition of the makeup technique, we can highlight certain region of the face also with the hyaluronic acid. Of course, the HA will not able to do a contouring, because you will not erase the face with the HA. You can only highlight certain region of the face with the HA. But you can combine for the patient, for the younger patient, like the star, to use makeup, to use brush, to use contouring, and to use on the same time the injection of hyaluronic acid. And the objective is to highlight. You can see on this on the screen this slide with the highlight natural region of the face, the forehead region, the medial lines of the nose, the chin lines, the natural reflex, the natural junction between the forehead to the tip of the nose. This is an homogeneous light lines on the mid face. More laterally, you can see these two regions on the mid-face and on the cheekbone with the maximum reflect of the light. And you can play on this region with injecting in deep plane, volumizing technique. And you can also go laterally to change the face to in order to obtain a V-line, more sexy, attractive face. On the mid-face, you can go down to the lip, and you have some reflect point on the philtrum area of the lip, of the upper lip, and you can, with two small bolus, inject these two regions, and you can rebuild the natural and sexy shape of the superior lip. If we go down, we can draw like with a pencil the limit between the red and the white lip. And if we go down, we can also change the projection and the light reflect of the chin. You can see with this last slide, on your screen, the label indication in the use of HA in order to project the volume and to keep the light. This is the region where the distance between the skin and the deep structure is very short. So with a small amount of product, when you inject the HA, immediately you restore the homogeneous lines, and you keep the light on the face. So tonight I will I will inject in this young patient. She's 27, 28 years old. She has never done any injection before, and she's very nice. And this is why this is a challenging approach, because we have very nice model, nice patient in our office, and they want to be nicer, but to keep this beautification for a long time. So the indication for the strobing, the highlighting techniques is to maintain, to write the evolution in the beautification, and not only to stay on the same vision we had before the anti-aging. We don't have to wait to be worst to begin a treatment. So as early you begin, longer the effect will be done. So we can now use the HA as we can use the brush for the makeup, playing on this region of the face. So can I have a pencil to draw the patient before? Okay, so you see the patient on the frontal view. She's very nice with natural reflect. You see the mid-face, the cheekbone reflect, the eyebrow area, and we'll try to find where exactly I can put my HA in order to keep in my mind the most natural results, but to improve the patient. So if I go up to down, I will draw this lateral. The bone is here. You see the landmark for the bone. The limit is there. So you just be up of the bone, the orbital bone, and you can draw the region you will inject. The effect of this injection will be to obtain like a botulinum-like effect, a small lift effect of the eyebrow, the lateral region of the eyebrow, and we will keep the light if I inject this region. I will inject also a smooth treatment, very small amount of product. The cheek, the mid-face, and I will make, as we can do with the brush, with the highlighting brush, a lateral injection in order to change the shape of the face to be more triangular, more V-line. This is more a V aspect of the face. So I will inject this region and I will project this place also. For the lip, I think the lip are very nice, but we can just improve this region of the philtrum of the lip and the bow here. A small line like with a pencil here. And can you move a little? Turn. Okay, sorry. So in the profile line, you see two things. The profile can be changed with the filler. You see the nose is long, with a falling tip, with a big hump.
We have a quick question.
Yeah.
Sorry to interrupt. From the chat, which is: are you going to inject in the nose?
Yeah.
Okay.
Yeah, I will inject also the nose. This is why I make the profile analysis before now. So I will. Can we have the vision of the patient? Okay, it's okay. So I will change. Don't move. Perfect. I will try to be on the same line with the chin and to over project the region of the chin. Okay. This is like the makeup. We erase, we change the shape, and the sculpture will be done by the HA. Of course, this technique is linked to the product we use, and the range with Filmed is perfect for this this kind of. This is like for the 2.4 protocol. This is only linked to the Filmed brand. So now I want to change again on the profile, and for the nose, is very, very high nose. So you see this angle between the forehead and the nose is very open. And if I feel a lot, the danger, not the danger, but the risk, the aesthetic risk is to obtain a Greg profile. So the same line between the nose and the forehead. So I will try to make a camouflage of this hump, and I will inject the amount of the product, and I will push the forehead anteriorly to reduce the length of the nose if I inject the forehead. So I will feel the hump, and I will change the length of the nose. And I will also try to lift up the tip and to make the small rotation. This is not an easy nose, because I think ideally it's a surgical indication, but I'll try to, to do this. So the challenge is to highlight the eyebrow. Don't move, please. The mid-face, the lateral injection, very smooth junction. In fact, the face is an illusion, because if you just think about the region you have to correct, you are not in the right in the right thinking. You have to think in your mind that every region of the face are linked, and in order to obtain a fullness result of your face. Okay, for the nose, so I will inject this region. I don't know if you are.
We have another question. Dr. Elizabeth from Dubai. Is it more a profiloplasty instead of contouring?
We'll combine the both technique, because this is a contouring, highlighting approach, but also a profiloplasty approach. The both, they are not different. We can make highlighting technique in the field of profiloplasty. In this patient, we will change the face, the facial view, but also the profile view.
Thank you.
So we will do the same. But the most difficult will be the nose, in my opinion. So we begin up to down, and I think I will work with the needle. The ideal product to do this indication is the Universal from Filmed. All these indications are label indication. The nose is off-label indication, but in my practice, I do all my nose using the Universal, and I have a very great experience in the nose injection. So we begin the treatment. We can clean the face, maybe. The patient had before a local cream application for 15 minutes.
We have another question from UK this time, asking what is the label of the Filmed product?
For all the product, or we can speak about all the...
No, for the one you're about to use, for this specific patient.
The Universal I will use is the indication, the label indication are on the mid-face, on the lip, on the chin, on the mandibular lines, on the eyebrow, but we have not specific label indication, because now, you know, all the laboratory needs to make a clinical study in order to obtain the official label indication. But in our practice, this is our responsibility. We use the product in all of indication we use. It can be done. So for the nose, actually there is no specific product on the market all over the world, worldwide.
Very clear. Thank you.
So we begin with the Universal, with the 27 needle. This one, this one. Okay. First of all, we have to clean the...
What product, sorry to interrupt again.
Yeah.
What product then should we use for the nose here?
Universal.
Universal. For the nose this time, this is what you're going to use?
All the time, I use only this product in the nose.
Okay. Thank you.
But there is some technical specificity for the nose, and we will speak about them in a few minutes. Okay.
Okay, and thank you, Iraqi surgeons, for this great question.
No, don't worry. No pain. Okay.
That's true.
when you go out of the midline of the pupillar line, you have no specific danger about nerve or vascular injury. You are safe for this area of injection. So we can use the needle injection, and you can see the limit of my injection, and I will slowly make a small amount, 0.2 cc, I think. So you see immediately, and you can make a smooth massage to obtain the result you want. If you want to compare immediately the both side, you can see on the right you have a lifting effect with only 0.2 cc of universal. You have the increased captation of the light, and this is why this indication is the highlighting treatment.
We have another question.
Yeah.
From Spain this time. Could you please give us the plan of injection?
For the eyebrow, this is a deep plane next to the bone, up to the orbital limit, bone orbital limit, above this limit, and next to the bone. And you will make a small and retrotracing bolus. Okay?
Thank you.
So now for the V shape of the face, and to make this this small amount is very interesting point, because you have a small lifting effect with the just immediately after the injection. So you go down. This is the same plane next to the bone, but you can be superficial if you want, more superficial in the hypoderm. And you see this small bubble, and you see the light, the difference between the both. You can make small position of the product.
We have another question from Argentine.
And this is like a sculpture. This is not like painter, not makeup, but like a sculpture in this indication. Okay.
So yes, his name is Dr. Ignacio from Argentine, and he's asking if instead of a needle here, you could use a cannula.
Because of the small amount of product I inject for each region of my project, I prefer to inject with the needle, and I have no specific danger in this region. The question will be maybe the one for the nose, and maybe I will do the nose with the cannula. I don't know at this moment, because the amp is very acute. The angle is very acute. I don't know if I can use a cannula or not, but for the nose, I prefer to use the cannula in the nose, but in this case, I don't know. But for all this technique, I think I will use tonight, the needle.
Okay, and so we have a follow-up question from France, which is, what do you recommend for beginner surgeon medicine, if they should inject using the cannula or the needle?
It depends the region. There is in your question there is two problems. There are two problems: the indication, the technique, and the risk. The cannula is very useful in order to avoid the vascular and nervous. Sorry for the. So the cannula is very useful if you want to avoid hematoma, bleeding, if you want to avoid embolic complication. But in some places of the face, you have no danger using the needle. Can we follow the treatment?
Great, thank you.
So now I will make this small projection. It's a small amount bolus, 0.2 cc. And you can change as you can use with the cannula. So you see the patient is very nice before, and she will be nice after, of course, but she has to be natural after the procedure. Okay, you can see the difference. I have done 0.8 cc of HA, this is the same syringe, and I have injected the eyebrow, and you see the lifting effect. This region, the shape of the V shape of the zygomatomalar area is more sexy, more attractive, but still natural. Okay.
So maybe this time we have a bit of a request. This time not for you, doctor, but for the patient. If she could compare with the mirror the two parts of her face.
Yeah, of course. Normally it's at the end, because at the end we have the wow effect.
I think we already have it. Wow. Qu'est-ce que vous en pensez?
C'est magnifique. On voit directement la différence déjà. Et déjà c'est assez hydraté, j'ai l'impression, et l'effet lumineux, l'effet highlight, comme on le veut en ce moment, c'est incroyable. Oui. Merci.
Okay, so the patient is very happy. She finds it has a great hydrating effect as a glowy light, exactly as we would want to have right now with all of the contouring and all the glowiness that we see.
So I continue the treatment on the left side. Maybe Please. I will change my situation. I will do the same procedure.
No more makeup.
No more makeup. Okay, this is the small amount. You see, open your eyes, please. You see the line is there. The pupillar line is there. So here you have the vascular pedicle, supraorbital and supratrochlear. And here you have nothing, no danger in this area. So the limit of the bone is there. You see, and I will inject this area to lift up the eyebrow. Always the same product, universal, 27 gauge needle, and you do the sculpture slowly. You press, you push the product exactly what you want.
Dr. Braccini?
Yeah.
Another question from Sweden this time. In this specific region, Dr. Talal is asking if there are any risk of specific complications.
This is what I thought about before. Can you give me the pencil? This line is the pupillar line. Okay, you have the infraorbital nerve here, and here you have the supraorbital and supratrochlear pedicle. The danger is in this way. Here you have no danger, no risk here. So if you inject this place of the eyebrow, you have no danger. You inject next to the bone contact, and you inject exactly the amount you need, but you have no danger. Okay? Now I follow the treatment. I continue my injection. Where is the second syringe now? This is a very interesting area injection, because you have the zygomatic arch and the malar bone very next to the skin, and the space is very small. So immediately you inject, you have the light captation, you have the highlighting effect. Okay. I do the same point, midpoint. You can ask the patient to make like a smile. Okay, so you have the ideal situation of the fat, the malar fat pad situation. Détendez-vous. Okay. And so you can inject next to the bone, and you don't need any retroaspiration technique, because you have no danger, no vascular danger. Okay. This product is fantastic because we can play on the volume of the face like a volumizing product, but you can also use it if you want to fill the lip. And now we will inject the lip. So for the lip, we decided before to inject this small, you can make a zoom maybe on the lip. You see the lip is very nice. Very, very nice. But we can just improve here a small bolus on the right and the left side and the limit between the red and the white lip. So you see the philtrum limit, the philtrum crest is there. So I will repair exactly the top of this region. You see? Okay. And I make a small bolus. Sometimes it's a little painful. We do 0.1 cc just to improve this. And you see the light captation is growing. You see between the left and the right. The level of the right side is up than the left one. You see the situation? There is up to there. The same technique at the top of the philtrum. It's like a heart. She has the lip like a heart, and this is the heart of the lip. We rebuild this. Ok. Compresse plus petite si tu as. Okay. And now I will follow the limit between the red and the white lip.
Doctor?
Yeah.
We have a question from Portugal.
Yeah.
Which is, how deep are the infiltrations? Do you go up to the SMAF? SMAS.
SMAS?
SMAS.
Up to the SMAS, but where? In the lip? There is no SMAS in the lip.
Not in the lip, sorry, yes, in the before injections that you did.
For the mid-face? For the zygomatic injection?
Yes, for the mid-face.
For the mid-face, we are deep in the SUF. Okay. This is a very deep fat. It's a fixed fat. And we inject to make the bolus in this region. If I inject more superficially, it's in the malar fat pad. It's a dynamic and superficial fat, which moves with the expression. When I inject the superficial fat, I have to be more fanning technique. If I go deep to make a structural injection, I will be in the SUF. Okay?
Yes, and since we're here, we have another question from Sweden.
Okay, wide word.
In which level are you injecting?
For which injection? Because
mid-face still.
For the mid-face, this is what I said before. Maybe it's the same question. For the mid-face, I inject for the volumizing effect deep next to the bone to project the mid-face. This is a fixed fat. The name is SUF. If I want to make a more superficial injection, I inject in the superficial fat, and we don't have to make bolus. We have to make fanning deposit of the product.
Thank you very much, and thank you, Dr. Goossen, for making us go even deeper.
Okay, so now we can try to inject the sheen. You can see the profile. I will make this smooth correction. Okay. And at the end, we will do the nose. So we continue with the universal, the same. I will do all the procedure with the universal. It's very universal product. The name is the right name. You can use it everywhere on the face. Okay, you know, this area is done, the shape is done by the bone, of course, and by the muscle, the two mentalis muscle, and the fat. So if we want to change the projection on or the shape of the shin, we can play and inject differently.
Question from Germany.
Yeah.
In each area that you've injected so far, how much product did you use each time?
I have injected for the eyebrow 0.2 cc. For the lateral injection of the mid face, for the cheekbone laterally, I've injected 0.2 or 3. Okay. For this volumizing injection, I've injected 0.3 for both sides. For the lip, 0.1, 0.1, 0.2. And we have used 2 syringes at this moment of the procedure.
Okay, quick question. If it's possible to go back to the mid-face, because we really have a lot of questions from this area. So in the souff, in the mid-face, of course.
Yeah, let me know.
Is there any risk with the
Orbital nerve.
Yes.
Yeah, this is
Thank you.
The risk is the infraorbital nerve is on the line, the mediopupillar line. This is the exit area of the nerve. 5.3, 5.2, 5.1. So the point, we can feel this bone difference with the exit zone of the nerve. We go just externally of the nerve.
Okay, thank you, and thank you all of your Chilean doctors for your being there with us on the chat.
So now we try to inject the chin. Okay, next to the bone. Okay. We have no specific danger. The facial artery is running more laterally, so we have no specific danger.
Question from Aman Jordani.
Jordani, yeah.
What is the plan of injection?
Between the two mentalis muscle next to the bone. Okay, but I will slowly go more superficially to use less and less product. The foundation is down next to the bone, and slowly, if I need, I will inject more superficially.
And so same question as before, is there any risk in this specific area?
No, because we are between the V shape. This is a V space between the two muscles, and we have no specific danger. The facial artery is crossing the face at the midline on the mandibular line, and there is no specific danger in this place.
Thank you, doctor.
So you make the sculpture because the product will go exactly where you push, where is very moldable. So I will be more superficial now in the hypoderm.
I think you've said it already, but we still have this question from Italy, which is, can you please remind us which product you're now using in the chin?
For the chin, the ideal product is the volume, the arfiller volume product, but we can also use, as we do now, the universal. This is the same one. So maybe to project, we use more product than the volume, which is a specific product for the projection. You can change the shape.
What's the label of this specific product? Universal? This is from Switzerland.
For universal or for volume?
For universal.
You can inject in the lip, in the mid-face, in the chin, everywhere on the face, but there is no specific indication for the nose and for the teeth row.
Thank you.
Okay. Maybe we'll see the result of the chin, or at the end we do the profile view. At the end, maybe. Yeah?
Perfect. Let's do at the end this time.
Okay. So now we'll do the key point, the nose, And we have to fill and to restore the line of the nose, the homogeneous line from the eyebrow to the tip. This is the name are the chin lines of the nose. This is the homogeneous shape of, and this is parallel line of the nose. And you see with the hump, it's broken here. Okay, so I will do it with the needle because the angle of the profile is too acute. So I'm not sure to be able to go with the cannula. Okay. This is the same product, universal needle, but there is.
Sorry, question from Lithuania.
Yeah.
I think you already answered, but maybe can you re-show us why you're using the needle instead of a cannula on this specific nose?
Okay, so maybe I will draw something for the nose because the risk of the nose are the vascular landmark of the nose.
Sorry, I wasn't clear. Just the follow-up question was, on another nose, would you use the cannula? Is it just specific to here that you use a needle?
The reference technique is use the cannula in the nose because of the risk of embolic risk. But if you use needle, and I will use needle, you have to do specific technique in order to avoid and to be at zero risk with your patient. The facial artery is coming from the external carotid, and she is running laterally to the nose. She is making a lot of branch to the tip, to the alar region. She is running, and she finished the course in the glabellar line. This is the classical division of, sometimes there is some branches here, some branches here. This is the classical high risk line, vascular line of the nose. So you have to never to inject in this area with the needle. But with a lot of surgery and with the variability of the patient, in fact, the nose is a high risky region of vascular complication. So we cannot say here there is no danger, here no danger, or here no danger. The danger is everywhere in the nose. So this is why the classical and the reference technique is now the cannula. But if we want to use the needle, which is more precise and some kind of indication, like this patient, you have to adapt the technique to be safe and to be sure that when you inject the filler, you have no risk. And I will do this with the needle, with no risk. Okay, so the first step for the nose correction, okay, in this patient there are two indications: the camouflage of the hump and the tip autonomization. Okay, we will begin by the nose treatment and the filling between the forehead and the nose. You have to push laterally with 2 fingers strongly to decrease the vascular the vessels in this area. You will push also to keep the product in the same line to obtain a very aesthetic result, and not to a wide nose and forehead junction too large. So we push the needle next to the bone because you have to inject in the deep plane. But before the injection, you have to make, this is mandatory now, a retrotracing, retroaspiration test. You will see the syringe, and you see the bubble, the syringe, yeah, you see the bubble. So there is no blood. So I am sure I have no danger, and I up.
Question from Bulgaria,
Yeah.
if I may. Could you use another filler than Filmed for the nose?
Never.
Why is that?
This is like when you drive a car. Why you change the car? Because I love this product, and this is for me the best one for the nose. I have next to 1,000 medical rhinoplasty in my practice, in my experience, and I have no complication, never, no complication. So for me, it's the best product in terms of efficiency and in terms of security.
Okay, so follow-up question from Greece this time. Is there on the market another product that is marketed to be used for the nose?
I don't know this. I think no.
Thank you.
Not at this moment. Maybe in the next future it will be. And we are working on clinical study to obtain label indication for the nose also.
Thank you.
So you will see the difference. Of course, it's better because you see the amp is less important. I will continue, but it's better. Okay, I will inject now again, same one, in the forehead region to project the nose before, and the same test before, to be sure there is no blood in the syringe. We can make bolus. Okay. And I will try.
Sorry,
we have
while
time
you're
again.
there. Yeah, from Bulgaria again. Can you please give us the quantities that you're using right now?
Right now, half syringe. In this syringe, we have 1.2 cc of HA, which is 20% over than all the syringe on the market, and I've used 0.6 half syringe.
Okay, and so from Morocco this time, since we're in the forehead, can you please give us the danger that you would have in this area?
The danger is the supratrochlear pedicle, so, and the branch of the facial artery, the end of the facial artery.
Thank you.
So we'll maybe I will continue a little on the. But we discussed with the patient before. I will not be able in this case to erase all the amp on the profile view, but to decrease the size of the amp. But I will play on the volume of the nose, and I will try now to make an automation of the tip. Maybe it will induce a very nice effect on the profile. So if you inject the tip, sometimes it's painful. So you have to choose the right entry point. Okay, don't move.
Azerbaijan, question. Do you use a specific anesthetist for the tip of the nose, which is very painful?
Only cream. Only cream.
The cream that you used at the beginning?
Yeah. But in the product, you have the anesthesia. And since you begin to inject, slowly you have the effect of the anesthesia.
And so from Belgium, same question. What are the dangers in this specific area?
The same. The artery branch of the facial artery. So you have to, don't change the position of the needle. Every time you change the position of the needle, you make an aspiration test. And you make small amount and slowly injection.
From France, I think the French are thinking of you. Comment est-ce que vous vous sentez? Est-ce que ça fait mal?
Non, pas du tout. Enfin, j'aurais pas dit pas du tout, mais c'est supportable.
Et même sur la pointe du nez, even on the tip of the nose?
Le nez un peu moins. Ça fait un tout petit peu mal, mais grâce au docteur, au doigt de fée du docteur, ça se passe bien.
So the tip of the nose is indeed the most painful area, but it's all bearable and not too much pain for the patient.
Okay, slowly the nose is changing, and you can see the reflect, because this is the objective of today, to restore the highlighting reflect of the face. So you can see the nose is in the same indication. You see the light, this is homogeneous light, and the line, you see the reflect here, is very regular, very soft, from the forehead to the tip. This is a highlighting, regular highlighting injection. So of course we do the profile, but we manage the reflect of the light on the face, and the glowy face, you will obtain a very glowy face.
Quick question from Switzerland,
Yeah.
which is underneath the eyes. It's a zone where we often put makeup on. You didn't talk about the zone. Is it something that you would inject or not?
Where the teardrop, les cernes en français. We see the teardrop. There is no label indication, and I prefer to use another product if I have to fill the teardrop and the dark circle.
Thank you.
The fine lines, exactly. Okay, no blood in the syringe. I am secure. Okay, the nose is now shorter. And I will try to make a small support of the tip here to make the rotation and to finish the injection. Sometimes it's a little painful. We open the angle between the nose. There is a columellar artery, so you have to make the retroaspiration test here also. And you push in order to get the columellar area very thin. So now we will see the result on the profile for the chin and the nose. And you can see the reflect of the face, this very regular shape, V shape of the face, the rose. And on the facial view, the nose and the chin, and we turn slowly the patient, and you see it's very smoothie. It's a very nice result. You see the forehead now is anteriorly, the nose seems to be shorter, and the situation of the chin is more linear with the lips. She was very nice, but now she is, I think, improved with this very natural highlighting technique procedure. We have used 4 syringes of product for this patient, all the same product, the universal product. And I think it's time now to give the mirror.
Yeah, just one last thing from Croatia. Can you please confirm that on all of the zones of the face you've injected tonight, you would never use any anesthetic product? Even the columel for the nose?
Only the cream.
Only the cream.
Only the cream, and for the columella, no cream. She was courageous.
Et
so
le columella, alors, c'est supportable?
Oui, c'est supportable.
Very brave patient tonight.
So now I think it's time to show the patient on the mirror.
Yes,
no?
let's do the before and after, so you can give us your impression. On va vous donner le miroir.
This is a very important time. She was afraid before the procedure. She was upset about the natural results.
Yes.
So this is time to...
Le grand verdict.
Go, do it.
C'est très fin et voilà, c'est naturel surtout, c'est ce que j'avais demandé. C'est parfait, merci.
She says it's very light. She was very afraid that it was not going to be natural, but it's all as she expected. Very natural beautification.
Okay, do you have any more questions for this technique?
Well, actually, we've had, I would say, so many questions right now that maybe just if you could re-explain to us what was the plan of injections, the doses, the quantities that you use of each product.
The summary of the procedure.
I think so, because we really have many, many questions.
Okay. For the product.
Sorry, everyone. Yes, from all of the doctors following us tonight, we won't be able to answer you all, but we'll try and do a very precise summary right now.
Okay. So for the product we have used, it was the universal product. It is a very easy product with the the best equilibre for the properties with elasticity, volumizing effect, moldability, tolerance of the product. So we decide to make all the face to highlight all the region with the universal. We used 4 syringes. Okay. For the plane of injection, for the eyebrow, we have injected in the deep plane. You go next to the bone, you feel the bone, and slowly you push with a retrotracing technique a small bolus of product to obtain this kind of reflect, this kind of lift effect. For the mid-face and the lateral mid-face, we have injected next to the bone with the same product, 0.3 cc, 0.2 here, 0.3 here, 2 or 3 here, and for the mid-face, we have injected deep in the souff. This is the deep compartment of the fat, fixed fat, and we have injected 0.3 cc to build the mid-face of the face. And I have injected also with a fanning technique more superficially in the dynamic fat a small amount of product. So this region is deep bolus, and if you go superficially, fanning filling. For the nose, you go in the deeper plane because all the arteries are more superficial. You go deep next to the cartilage, next to the bone, and we inject. If we use a cannula, there is no specific danger. If we use a needle, you have to make a retroaspiration test before the bolus, and you use the retrotracing technique. For the chin, I have made the projection of the chin to obtain a very smoothy profile. But I made the junction between the upper lip and the chin in hypodermis plane. And the lip, 3 specific point of injection, the philtrum, this top of the art of the lip, of the upper lip, on the both side, 0.1 cc, 0.1 cc, and there 0.2 cc. And for the nose, I have injected the camouflage, the hump, and the forehead 0.4, 0.5, 0.3 for the tip, and 0.1 for the spine region. Do you have any more questions? We're on time. We have time for questions. How many countries you have tonight?
How many countries? We don't even know yet, but seriously, we've had so many questions tonight, it's crazy. A lot of the doctors that are following us are thanking you for all of your work and are very impressed with the results, just like the patient, I would assume. So thank you very much for what you have done, for teaching us tonight, and for the amazing work. Everyone is super impressed.
Thank you, Raphael. Thank you all the Simul Channel team.
And so now, to all of you following us, I'm sorry we're not able to answer all of the questions tonight, but thank you so much for being so active on our live chat from all over the world. It was a pleasure having you, and we will see you for our next live session on July 2nd. Thank you so much. Have a great evening. And thank you, Dr. Braccini.
Thank you, Raphael. Thank you.